Hi, my name is Nicole Silva, and I'm doing my presentation on my internship at Kedron Community Health, which is a clinic in South LA. So, to begin, the recruitment process was fairly simple. I had an interview, a Zoom meeting with someone that would be placing me in my desired department. From there, we came to the conclusion that I would be interested in working in the health education department. So, from there, shortly after, he said I would be getting in contact with the head of that department, the director of the health education. So, that Zoom meeting went fairly well. She told me I got the position. And then from there, we were setting up my work email. I had to get a live scan done, get my background check, just, the basics. And then actually going into my internship work. So I was working with high risk patients that were, pre-diabetic or diabetic. I was helping them in giving them preventative health services like those health education classes. And I was engaging with these patients. I was given an Excel spreadsheet, one for diabetic patients, the other one for pre-diabetic patients. And like I said, I had to engage these patients, ask them if they would be interested in participating in these services that we had available for them. Aside from that, I was also tracking all the patients that were attending the classes. I was tracking them, tracking their A1C level, which is basically a blood test that sees how much sugar they have. And the reason I was doing this is because our goal was to lower these A1C levels. If we had a certain amount of patients that met this goal, we would be recognized by the American Diabetes Association. And again, that was our end goal. Again, aside from this, I was also able to help teach these classes. So at first, I was kind of sitting at the back, maybe helping with little things. We had these patients sign in. I was helping pass that sheet around, helping patients, little things like that. And towards the end, I was actually given the opportunity to help teach these classes. I was translating for the Hispanic patients, which was an awesome, opportunity. So some skills that I was able to brush up on were my organization skills. As I mentioned, that I had to keep track of these skills. So, organization, is something that I, kind of typically struggle with, especially throughout college. So really being able to brush up on that skill was, very helpful. Again, I had to track, I had to pay attention to detail, sometimes looking at the same Excel spreadsheet for hours, I kind of didn't notice maybe minor mistakes like putting an A1C level under the wrong patient, or again, things like that. I really had that attention to detail, having to go back, overlook, and see, making sure everything was correct. Aside from that, I was able to really work on my communication skills and my interpersonal communication skills as well. As I said, that I was speaking with these patients over the phone. I was able to actually have that FaceTime as well with these patients, and having to be, again, professional, having to be nice, understanding. For the most part, patients were very, nice, receptive, but you did have some rude patients, and again, having to keep your composure, handle that in a professional manner. I was really able to, again, work on that skill. And also, being more confident. Like I said, I was doing the public speaking. I'm teaching these classes for patients that I don't know, again, speaking in front of them. Also, like I said, I was translating. So I come from a Hispanic household, but we typically do not speak Spanish in here. So I was, kind of uncomfortable with some words I didn't know, especially medical terminology. I had no idea. So I was able to really work on my Spanish speaking skills, which I'm very, very grateful for. Coming into this internship, that was the last thing I thought. That didn't even come to my head that I would be working on that, but I was really able to work on that. I'm more confident as well in speaking Spanish, which again, I really appreciate that. And then, kind of just to wrap it up, I mean, I would consider myself pretty helpful to the organization. I was always very eager to help. I was always interested, in learning different things, anywhere I can help. Again, just trying to be there, provide these classes for these patients, doing what I can for these patients. I was always very interested, again, always very eager to expand my resources like that. And then also, as I mentioned, that our goal was to get ADA recognized, so I actually was able to help them achieve that. We were able to get ADA recognized, so again, that was awesome. And throughout the most part, I learned a lot. I learned a lot about the back ends of healthcare. Again, I was exposed to that patient info, like their A1C levels, HIPAA laws. Again, seeing that all take place was pretty interesting. And then also, I learned more about kind of this field, about community health field, being a healthcare administration major, being face to face with patients is not something that you typically, would see yourself doing. But again, having that experience, being able to talk face to face with these patients, as I said, I was working with diabetic patients, helping them, again, overall be healthier, reduce their chances of certain illnesses, things like that, was a very fulfilling job for me. And then, just to go, about my future endeavors, I mean, I graduate the end of this month. So, kind of take the year, really focus on different jobs that may, are related to my field, or, again, community health jobs. Again, brush up on certain skills like professionalism, technical skills, working more with, Microsoft and Excel. I really feel the need to brush up on those. So again, just through practice, maybe taking coursework that I can find, little classes. After, maybe taking a year of that, I plan to apply for my master's and just continue to grow, explore my options, and really get out of my comfort zone. Thank you. That concludes my presentation.